Today we shall be going to cover the cranial fossae, that is the internal view of the base of skull. This is the internal view after removing the vault of the skull, and this is the external view of the norma basalis or the basal view, starting from anteriorly going posteriorly. And similarly here, the interior of the skull is thrown into three depressions. The anteriormost and the superiormost is the anterior cranial fossa. The middle one is so named middle cranial fossa and posterior cranial fossa. The anterior cranial fossa, as you can see, it overlies the nose and orbital cavities. The anterior cranial fossa is the shallowest of the three fossae, and it accommodates the frontal lobes of brain, cerebrum. The anterior cranial fossa, इसके बारे में the description that a student of anatomy must know is the boundaries of the anterior cranial fossa. So starting from anteriorly and laterally, anterolaterally. The anterior cranial fossa anterolaterally is bounded by the inner surface or internal surface of frontal bone. Inner surface or internal surface of the frontal bone. This is frontal bone. So its inner surface is bounding the anterolateral boundary of the anterior cranial fossa. Posteriorly in the midline, you can see the cranial fossa posteriorly in the midline is bounded by a bony ridge. This sharp bony ridge is known as limbus of the sphenoid bone, and this limbus forms the anterior boundary for the prechiasmatic sulcus, which is a groove lying between the right and left optic canals. Prechiasmatic sulcus. So the limbus in front of this sulcus, which is called the limbus of the sphenoid bone. As you can see, this is the body of the sphenoid in the middle. So posteriorly and in the midline, the anterior cranial fossa is bounded by the limbus of the body of sphenoid that forms the anterior boundary for the prechiasmatic sulcus, which is a groove bounded or lying or located between the two right and left optic canals. Extending and going posterolaterally, the anterior cranial fossa is completely bounded by the sharp, almost triangular, bony projection, which is known as the lesser wing of sphenoid. This whole sharp, almost triangular, bony projection is known as lesser wing of sphenoid. And this lesser wing of sphenoid binds the anterior cranial fossa posterolaterally. If you note down, this lesser wing of sphenoid medially is ending in two rounded projections. These two rounded projections are known as anterior clinoid processes. Anterior clinoid processes. The floor of the anterior cranial fossa in the midline is formed by the ethmoid bone. The ethmoid bone shows crista gali, which is an upward projection of the ethmoid bone. Crista gali. If I turn the bone slightly, you can see this here, right in the midline of the floor of the anterior cranial fossa, is a sharp projection. This sharp upward projection is part of the ethmoid bone and it is itself known as crista gali. Going again laterally, the floor is completed by the orbital plates of the frontal bone. Orbital plates of the frontal bone. Posteriorly, the floor is completed by the body of sphenoid as well as lesser wing of sphenoid. The ethmoid bone in the anterior cranial fossa contains multiple small foramina. If you can see this small, 1, 2, 3, 4, 5, 6 on either side of the crista gali. These foramina in the anterior cranial fossa, they pierce a sheet of bone on either side of crista gali, So the foramina piercing the sheet of bone, that sheet of bone on either side of crista gali is known as cribriform plate. Cribriform meaning sieve-like. Any structure having multiple small holes in it is known as a sieve-like structure. जैसे चाय की छाननी होती है या पोनी होती है, जिससे हम चाय जो है वो पुनते हैं. That's just like that. This plate is sieve-like. This is why it is known as cribriform plate. Again, part of ethmoid bone. So if anybody asks you what foramina are present in the anterior cranial fossa, you are going to tell them that there are anterior ethmoidal foramen and posterior ethmoidal foramina. And these foramina, they transmit the artery, nerve and vein of the same name. That is anterior ethmoidal nerve, artery and vein, posterior ethmoidal nerve, artery and vein. Then we have cribriform plate foramina, the foramina piercing through the cribriform plate. These foramina are responsible for transmission of olfactory nerve fibers into the nasal cavity. So between the nasal cavity and the anterior cranial fossa, the olfactory nerves, there are multiple fibers, they pass through this cribriform plate. And